Hello, we are the Association for Child and Adolescent Mental Health, or ACAM for short.
Hi, my name is Choden Dukpa and I am one of the authors for this paper. I work as a research administrator at a Darjeeling-based organization, that is DLR Prerna. Before I move into our research questions or research objectives for this paper, I'll just give a short background about the intervention that we're having. Um, so the intervention is TLEAF, which is a research-based study on child mental health. The abbreviation of TLEAF is Teachers Leading the Frontline, and we've been running this trial since 2018, where we've been implementing a task shifting model by training teachers in providing mental health care to the students within the classroom setting. So the schools that we work with are all located in the rural regions of Darjeeling and Kalimpong district, which is within the West Bengal state in India. So these schools are all low-cost private institutions, and as a trial, it is a full-fledged 4-year RCT, that is randomized controlled trial. So we have the schools divided into two groups. So one is the intervention arm, and the other is the comparator or the enhanced usual care arm. So when it comes to the enhanced usual care or EUC arm, we wanted some form of engagement with them as well, which would be as ethical as possible, and it would also be fair for them as they are engaging with us for a very long period of time. So hence, what we did is that we came up with an abbreviated version of TLEAF for the EUC arm, and we named it RESEED. That is responding to students' emotions through education. So in RESEED, what we do is we give basic training on mental health to the teachers, where there is no direct intervention with them after the training. Uh, However, the teachers are free to reach out to the team in case they need any kind of help. Um, so talking about the training model, it is a 3 days training module that we developed, where we introduced child mental health to teachers and its importance. We also introduced a behavior plan tool, which is called the FOSSES plan, where the teachers are taught to fill up a FOSSES plan form to try to figure out the cause for a child's behavior, the changes they could make to intervene, and also how they could connect more with the child, and lastly, how they could cultivate good behavior amongst the children. Um, so for this paper, our major research objective was to evaluate the impact RESEED had from a teacher's perspective, and also understand the process of its implementation in a real world setting. Um, so what we did is that at the end of the school year, after the teachers were trained and they had implemented RESEED in their particular schools or classes, we conducted a qualitative assessment through focus group discussions with the teachers who were trained, and we tried to understand their perspective and experiences while implementing whatever they had learned from the RESEED training. Um, so I would now request Setareh to take this video forward. Thank you.
Hi, my name is Setareh Ekhteraei. I'm a fourth-year medical student and one of the authors on this paper. I'll be discussing the results and implications of our study. So from our focus group discussions or interviews with the teachers involved in RESEED, we were able to assess various themes that came up in regards to how RESEED was received by teachers, by students, and also by the greater community. We found that teachers thought that RESEED was acceptable overall. They felt that after the intervention, children improved not only in their academic performance in terms of grades and standardized test scores, but also in their behavior. For example, children that were quieter before were more willing to speak up in the classroom. Various themes that were present throughout the interviews included a need to apply the intervention to all children, to have more teachers receive the training, and that overall the community felt positively about the intervention and grateful for the intervention. What was particularly interesting was that there were changes in beliefs about mental health and the child thought process that teachers demonstrated in these focus group discussions. There was an apparent shift from corporal punishment to encouragement and engagement of children in the classroom, and how this change affected children. There seemed to be a sort of mental reframing that involved basic principles of child mental health without delving deeper into the complexities of child psychology. RESEED was deemed feasible because despite the fact that it was rather short, kind of 3 days long training and involved minimal external support, it was positively received, and teachers felt that it impacted their own beliefs in addition to resulting in positive behavioral and academic changes in children. Because of the need for youth mental health approaches in low and middle income countries, RESEED could be a feasible first step in improving teachers' mental health literacy and beginning to address the mental health needs of youth in resource-limited settings. Thank you.
Find out more about becoming an ACAM member and to be part of the advancement of child and adolescent mental health. Visit www.acamh.org.